There is perhaps no bigger debate in education than the idea of how to represent how well students have mastered a course. Traditional grades, while easy to understand and interpret, have been criticized as taking emphasis away from learning and more on gaming the system. Some say that traditional grading creates anxiety for students. What's more, basing a grade solely on the results of a few exams might not indicate whether the students have truly mastered the material. Rather, it might indicate that students know how to navigate a multiple-choice test. Faculty and administrators in the College of Pharmacy at the University of Tennessee Health Science Center have been exploring specification grading as a solution to these challenges. They want to know whether this grading schema can better prepare their graduates for their careers while helping to identify at-risk students to get them the help they need to be successful. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. This month, we're talking to two of the participants in a study titled Specification's Grading System Impact on Grade Distribution in a Third-Year Pharmacy Skills-Based Course. The poster was presented at the 2025 annual meeting of the American College of Clinical Pharmacy. This study was undertaken by Dr. Tabitha House, Academic Fellow, Dr. Don Haverda, Professor and Associate Dean for Academic Affairs and Assessment, Dr. Taylor Littlejohn, a graduate of UT Health Science Center and currently a clinical pharmacist with Christ Community Health, and Dr. Catherine March, Associate Professor. Two of the panel join me today to talk about their study. Tabitha, welcome.
Hey, I'm happy to be here.
Great to have you here. And Katie, welcome to you.
Hey, thank you. I'm also very excited to be here.
I'm really interested in this poster and this whole idea of spec training, so let's just get into it. First question, Tabitha, can you briefly summarize your poster and why this topic's important to you?
So this poster was taking a look at how specifications grading was implemented into a different cohort of students. So previously, the students were graded in a traditional manner, points-based, equaling to a percentage. But with specifications grading, they were given a table, pretty much just like a rubric, and you had to reach all of the requirements in that specific bundle to get an A, to get a B, or get a C. And after that grading schema was implemented, we saw some significant differences in the grade distribution across the board for all the students. And so I wanted to create a poster to look at those differences and kind of talk about why the emphasis placed on mastery is important in comparison to a traditional grading schema.
And this is related to a sort of an overarching curriculum change going on in the College of Pharmacy right now. That a lot of changes going on for students with curriculum and grading and all kinds of different things.
Yes, implement a new curriculum with the specifications grading going to be the primary grading format that they're going to be using.
So what were your primary findings?
So what we found with the traditional grading format, 95% of the students got an A, which could be a good thing, but also could mean there's some grade inflation and different things like that. So once we implemented the specifications grading, which had specific qualifications that students had to meet in order to get an A, a B, or a C, we saw a wider grade distribution. I believe 54% of the students got an A. There was a percentage that got a B. And then there also were some students that got D's and F's, which ultimately, you don't want students to fail a course, but that just shows that they didn't demonstrate mastery, and it gives us a chance to remediate and pinpoint what exactly they didn't get and help them reach that skill or achieve that skill before they go out into rotations or practice and things like that.
It reminds me of when I was an undergraduate, I did take statistics. And I had to take statistics a couple times because of changing majors and stuff like that. And I had to take it during my graduate work as well. And I did pretty good in the class. But I always walked away not really feeling I really understood what I was doing. Is that, they were multiple choice tests and I checked the boxes and I knew what the formulas were and all that stuff. But if you had asked me to really explain what I was doing in a deeper sense, I would have not had a clue.
Yeah, I bet some of our students that did that traditional grading may have had that same kind of feeling.
Yeah, so I can understand the mastery. And then the other part of it is that some people are naturally good at taking multiple choice tests. So again, it doesn't necessarily measure how well you know the material, but it's how well you do in the test.
Yeah, Tom, what you're describing is brain dumping. So you cram for the exam, and we know that students do that, especially in the College of Pharmacy. They have cumulative exams, composite exams every 2 weeks. And so they cram for that and then they dump that information. And so kind of with specifications grading, it helps us to know, okay, well, you need to demonstrate to me that you can do math. You need to demonstrate to me that you can counsel a patient. You need to come to class and participate. They have to show that they can do all of those things separately to get an A in the class. And if you can't do math, but you can do the other things, you're not going to get an A. That's where our D's and F's came into play.
Someone described that to me once as the binge and purge method of learning, and that there's no nutritional value in that kind of education.
Right.
How students are graded is a big topic of debate in learning. And I can't tell you the number of articles and emails that are on my listservs and topics amongst my counterparts about the whole idea of grading. There are books written about, ungrading and the negative consequences on learning that traditional grading has on student learning. So with all these different schemas that affect not grading and pass-fail and all that stuff, how did the College of Pharmacy land on spec grading?
Yes, so we did have a work task force that came together and looked at a lot of different grading models. And we chose specifications grading because, like you're saying, traditional grading puts a lot of anxiety on students because they want an A. They're striving for the points. And as an educator, a lot of the arguments that come from students is just about how can I get a point back? And the focus is not really on mastering the material. It's focused on the points. And so with specifications grading, it takes the points out of play and puts it on showing me that you can do something, not just finagle points. And so some of the great things about specifications grading that the college really liked is it's more transparent. As Tabitha alluded to earlier, you get a grading schema that shows you exactly what you have to do to earn an A. It lets the students earn their grade. So it's very transparent. It takes the focus off of the points and on to mastery. And if you've noticed, I know you said there's a lot of books about ungrading, and across the country in a lot of higher education schools, they are going towards competency and mastery-based education. So it is a sweep really across the nation that's kind of a trend that's moving away from these points-based systems.
And it's a game students play too, right? It's like, okay, I wanted an A in this class, or I'm satisfied with a B in this class. So this is how many points I need for the final exam. And so then you are studying for the test and the grade and not necessarily for what you learn. And I admit that I've played that game when I was an undergraduate. And I remember one of my kids telling me one time, it's like, I only need a 70 in order to get a B in the class. And so she didn't spend as much time studying as she would if she were doing spec grading and needed mastery.
Yeah, and so like on the flip side of that too, students, if you just want a C and just get out of the class, they can put in the amount of effort it takes to get a C. It's really, the onus is shifted more to the student and off of the educator or professor to kind of get them where they need to be. They get to choose. If you want to earn a C, you can. If you want to earn an A, you can. But at the same time, it also lets us know maybe you want to earn an A and you're really struggling in one of the mastery categories. It lets us know that maybe you need earlier intervention for that specific skill. And so we can get you to a learning specialist, or we can do math together instead of you just waiting to the end and then failing that portion of the exam.
So we talked about there's a lot of other grading schemes, including not grading at all. And the arguments, even with spec grading, is that you still have a grade, and sort of thinking about what grade you want can inhibit your learning. So did the college ever consider not doing grading at all?
Yes, we have considered not doing grades at all. So I think what you're describing would just be a simple pass-fail. Either you pass or you don't. And to be honest with you, just all the professors at the college are just not ready. It is a large mind shift. And it is difficult to comprehend specifications grading. Once you get into the weeds of it, it is complicated and it's difficult to standardize across an entire curriculum. And so it would be a little too much too fast, I think, to get rid of grading altogether for the students and probably all of our professors at the College of Pharmacy, but we did discuss it.
Okay.
We're just not ready.
Are there any indicators yet that this new schema indicate whether spec grading is promoting student learning? And if is, how would you go about exploring this?
Well, a couple of things that are already in place is there are some kind of end of course exams that students have to do specifically in this course where they had to demonstrate if they could do math, if they could counsel a patient. And so adding those qualifications into their grade helped them ultimately be able to demonstrate that they could do those things on the end of course, or, if they weren't able to, then they had to remediate. But also other places that we could probably see how well this grading schema worked is once students get out on rotations, the feedback that we hear from their preceptors, once they go on to take NAPLEX, looking at how they do on the math portion. I don't think NAPLEX has the math portion divided out like it used to, but having students practice math in this course and having it be a grade qualifier specifically makes them practice math, and math has been something that our students have struggled with across the board. So, looking at NAPLEX pass rates, and then just also once we implement it into more courses, looking at our exams as a whole, because I think we're moving away from composite exams and looking more towards like content exams for this one module.
I remember teaching a course once that had a prerequisite. And so students had to have taken a statistics class before they came to my research methods class. And I remember thinking sometimes, how in the world did you pass statistics? Because it doesn't appear that you're ready. And so I'm wondering if that might be another indication, if they're prerequisite classes, if students have to master those prerequisites, whether there's an indication that they're more prepared for those more advanced classes.
Yeah, I definitely think implementing specifications grading earlier in the curriculum would definitely show or make sure that students are prepared as they get into those higher level, higher thinking courses, and especially before they get out on rotations where they actually have to demonstrate these skills, not just to professors, but to preceptors, and also, working with patients. So I think implementing it earlier would be great.
So you mentioned earlier that a very high percentage of the students under the old system would pass these classes, but you weren't necessarily convinced of their mastery. And I can imagine as a student thinking, well, this isn't fair. Last year, 95% of the students got A's, and now you've put this new system in, and most of us are not getting A's anymore. How have the students responded, and how have you responded to those inquiries?
Well, I think Katie could talk about it a little bit more, but I do think that some of the students appreciated the transparency of the grading schema. They knew if I did these things, I would get this grade, but their overall feelings and thoughts, Katie may be able to speak a little bit more.
Yeah, I think that and just to be clear for everybody who may be listening, we did not implement this until the third year. And this was kind of a trial run that we did. So this was implemented in a third year skills-based lab. And so they had already been through 2 years of the curriculum and never encountered specs grading. So I would say on the whole, they actually took it really well. And you said, is it promoting learning? I think it does promote learning, but it also serves as a really good way for us to know who is not where they need to be to go forward. And so I know Tabitha and I keep talking about pharmacy math. And it's because pharmacy math is a huge component of the grading schema for these students. And so we've constantly been dealing with that. But it lets us know really where the bottom 20% of the class is. And so those people who are struggling with math need early intervention, or those people, another large component of this class is being able to write a pharmacotherapy plan for a patient. So making a recommendation, do you know how to counsel the patient, how to monitor the patient for toxicity, efficacy of whatever you're prescribing, and how and when to follow up with the patient. And so they have to demonstrate that they know all of those things, which they should, as Tabitha alluded to. They're about to go on to clinical rotations. And so it really lets me know where their mindsets are as they embark into the clinical rotations that they're going to go on in just the next 6 months.
It sounds like, Tabitha, you had said that maybe part of the success of this and the way students have responded is your transparency and your communication with them and helping them understand that this is why we're doing this and this is how it's going to help you. And my guess is that if someone's been struggling in the past, they probably appreciate the transparency and knowing that this is a way to flag early on if they need additional help.
Yeah. And A component of specifications graded does include a token system. Katie didn't implement a token system when she did the specs grading this time, but a token system allows students to retry or remediate something that they didn't do well on, so that they can demonstrate that they've mastered it. And so when Katie was talking about we're able to identify that lower 20% of the class, though that token system allows them to get up to where they need to be, because there are assignments that'll be embedded where they can demonstrate their thinking. Maybe they don't get a multiple choice question. They get an open response question where we have to have them write out their rationale. Why did they think this? And then they can discuss it with the course director and figure out where the gap is.
There's a line in your post. Let me read the line from this, and I'm going to ask you to talk a little bit more about it. You said, students developing mastery of a skill or concept ultimately develop critical thinking skills and provides confidence that learners can reliably apply knowledge in professional practice. I love that line. I wonder if you can talk a little bit more about it and how that relates to spec grading.
Well, that line really encompasses what specs grading is. If a student is able to demonstrate mastery of a skill or of content, then as a professor or as a preceptor, you can trust them to go out and work with patients or extract data from patients or make a recommendation to another provider. It gets away from, like Katie was saying earlier, I need this point to get this grade, versus I need to demonstrate that I can do this, or I need to learn how to do this so that I get this grade. And then once they get out and practice it, you're confident because they've done it before.
So you started the spec grading, and this is going to expand, I think, ultimately to all the courses in the pharmacy program. What changes do you recommend based on your study results, either thinking about what's going on with pharmacy or even also how this might apply to other health sciences or other programs?
Well, the first thing that I would recommend is kind of making a standardized specifications rubric across your curriculum. And we are learning that is difficult, especially when you get into more of therapeutics-based courses. Now, this was a skills-based course where before the specs was implemented, students had to demonstrate that they could do certain things. It was just they had to get the points, versus it's pretty much if they did it, it was fine. They didn't have to show mastery in everything to get the grade that they wanted. So the first step would be trying to get some type of standardization across the board, which is difficult. But there are task force that we have in place that are working towards trying to find what is competency in a therapeutics-based course and not necessarily just a skills-based course. So working towards that, and then kind of shifting the mind frame from trying to reward the higher achieving students and realizing that they're going to reach what they need to reach. They're going to accomplish what they need to accomplish. This allows us to identify the students that we need to help more. And by doing that, implementing remediation and different plans to help them reach the success at the level of mastery that we want them to reach.
How have the faculty responded to this? Because as you talk about this, it occurs to me that this could be a lot of work, a lot more work on them. It's more than now just running a scan sheet through a scanner or ExamSoft. It's a lot more work for them.
We do hear the words workload very often. We do. And you're right. So a couple of themes that we have tried to impress upon our colleagues is we're trying to do what's best for the students. So we are trying to implement something that is new, that's better for their learning. We do realize it is a heavy lift on the front end, especially with keeping up with how the students score in each category of your schema. So how do they do on every math quiz? How do they do on every exam? Do they always participate in class? It can be burdensome to keep up with those things, but there are things in Blackboard to help with that. And I'm sure in other learning modules there are as well. But once you kind of refine it, which might take a year or two, maybe 3, it gets easier. So, of course, anything we're doing is going to be harder on the front end. But I would just encourage those who want to try it to stick with it and get buy-in from your peers and your academic deans.
Sounds like also an argument for well-designed rubrics.
Yes, 100%. Completely agree. Which I've heard TLC can help with.
Yes, we can. We have all kinds of resources. We love rubrics in the TLC. So what are the next steps? Is there another study that's going to happen for this?
Fall of 2026. is when we will have the new curriculum rolling out with everyone doing specifications grading. There are some course directors that have elected to go ahead and implement specifications grading in their courses. So what I've done is I've sent out a pre-survey to them, trying to gauge how comfortable they were, what parts are they implementing, because they may not be implementing the full specification schema. And so gathering that information on the front end from the course directors, and then I'll follow back at the end of the semester, see what went well, what additional training or what additional resources did they think they may have needed, and then maybe any changes that they may implement. I didn't do a survey for students' perspectives because the courses that it's being implemented in, they haven't seen specifications grading before. So I wouldn't be able to do like a before and after with them. It would be new, but I've sent out something to the course directors because, like Katie said, a lot of things that we're hearing is workload. And so maybe I'll be able to publish something in addition to student grade distribution, but also faculty perspectives and things like that. So that when other institutions decide to implement specifications grading, they may know how to troubleshoot those problems.
This is great. Katie, Tabitha, thank you for this conversation. I really appreciate it. And this idea of spec grading, I think, is just fascinating. It's going to be really interesting to follow College of Pharmacy and see what effect it has.
Yes, of course. Thanks so much for having us. Thanks for having us.
And that's this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teaching and Learning Center at the University of Tennessee Health Science Center. Until next time.